Today we will be learning about coring of injection vials. Coring occurs when a needle cuts out a core or sliver from the rubber stopper, the closure, at the top of an injection vial as it pierces the stopper to enter the vial. Small pieces of the rubber stopper can break off and contaminate the sterile contents of the vial, and even be aspirated by the needle and injected into the patient. Coring poses several challenges and risks that must be addressed to ensure the safe administration of injectable medications in veterinary medicine. Here are some key reasons why coring is considered detrimental. The detachment of rubber stopper cores can contaminate the medication, compromising its sterility and purity. This contamination introduces foreign particles into the animal's bloodstream, potentially leading to adverse reactions or infections. Coring can result in erratic or incomplete drug delivery. If the rubber fragments obstruct the needle orifices, it may prevent the complete extraction of the intended dosage. Inconsistent dosing can impact treatment efficacy and patient safety. Coring debris with sharp edges can damage the needle, reducing its effectiveness and increasing the risk of needle-related injuries. This can cause discomfort, tissue damage, and necessitate additional medical intervention. Here are some preventive measures that can be implemented. Veterinary clinics and hospitals should prioritize the procurement of injection vials from reputable suppliers. By choosing vials that adhere to strict quality control standards, the risk of coring can be significantly reduced. Veterinary staff should handle injection vials with care to prevent damage to the rubber stoppers. Vials should be stored in appropriate conditions, following the manufacturer's recommendations regarding temperature and humidity to maintain the integrity of the stoppers and minimize the likelihood of coring. Choosing appropriate needles for administration plays a crucial role in coring prevention. Veterinary professionals should opt for needles specifically designed for veterinary use, ensuring they have polished tips and beveled edges that minimize the risk of coring. To prevent coring, the needle should be initially inserted at a 45 to 60 degree angle with the bevel facing upward. You will need to apply a small amount of pressure as you insert and increase the angle slowly as the needle enters into the vial. The needle should be at approximately 90 degrees, just as the bevel passes through the stopper. Using smaller needle gauges can reduce coring, but you need to ensure the gauge is suitable for the viscosity of the liquid being drawn up. Prior to medication administration, it is essential to visually inspect the injection vial for any signs of coring or compromised rubber stoppers. If coring is detected, the vial should not be used, and an alternative should be obtained. Veterinary nurses should stay updated with the latest practices and guidelines regarding injectable medication administration. Regular training sessions can help ensure that all staff members are aware of the risks associated with coring and the necessary preventive measures.